right, guys, here is part two. It's kind of a continuation of part one. I have to do it in short segments, otherwise I can't download it. Anyway, so I left off inside the care plan. So essentially, once you've done the care plan and you save it and then you X out or whatever, this is your note. And I went ahead and filled in a few of the answers just so you could kind of see what it looks like when it's on your actual note. So anyway, back to filling in the interventions, instructions, and goals. So after you're off the phone with the patient, let's see, you're going to come back into your care plan, and you're going to go here to the instructions and interventions. I basically have formatted, have a Word document that I'm working on doing, like all the different chronic care things, but right now I just have hypertension and diabetes. So for hypertension, I've got one already made up that's just a basic one, and then you can tailor it to your specific patient and their needs. But this is just kind of a general guide, and I can copy that and then come here and paste it on there. And of course I'll take out the intervention part because we're just on the instructions. Erase that, then go to the interventions, and same thing, paste that on, and then get rid of that right there. So this is going to be in the care plan. These are things that is going to go out to the patient, because once you're done completing the care plan, you're going to mail this to your patients. So once you put in instructions and interventions for your patient, then you got to go to goals. You don't have to select each and every one of these goals, but you need to, the ones that are pertinent to your patient, you need to fill out. Everybody should have some symptom management ones. I think these three pertain to everybody. If somebody's having problems with pain, then the first two would. Physical functional goals, cognitive functioning goals, nutrition goals. So you're going to go through all these, and like I said, whichever one pertains to your patient, you're going to fill out. Obviously, if they don't have an advanced directive, you're going to, choose this one, because we definitely want, I'm going to just hit select all. We want every patient, every Medicare patient really should have living will or advanced directive. Health expectation goals. Every single patient has health expectation goals, health literacy goals. Yes. For me, that would be all health coverage or access to care goals. Our practice really doesn't have many patients with a problem with this. But some will, or maybe some patients do have an issue, but if it is, you definitely want to address it. And then of course, every patient's going to have medical management goals. All right, so once you're done with that, then you can close out and save the care plan. And we're back to this page here. And again, remember that here's your area where you can edit or whatever. You're going to want to print this visit. Print the visit. That's going to print your care plan. That's what you're going to mail to the patient or send to them on the portal. But for most people, it's going to be mailing it to them. And then once you've done that, you're going to X out of here, and now you are back to your note. And then if you need to, add anything in right here, anything you may have addressed or something you think is important, put that there. And you've got your care plan done. Do your next appointment, as needed, or if you know when it is, put it in here. And then done. There's no E&M code with this because we're just billing for the care plan. So yes, we want to continue, and that basically is what you have to do to make a care plan. And then to enroll the patient, you know, under CCM, there's the enrollment thing, and you can click, I've already enrolled this patient, but you would click, there's a button right here, and it'll say enroll here. And when you click on that, this is the screen that you're gonna see. And you're gonna hit, you know, go to chronic care management will come up, then duration is 12 months. We do it in 12-month intervals. And then the consent, you're gonna put yes, because everybody gives verbal consent. And then if someone were to end the program and wanna stop, this is where you would stop the program for them. You would hit end program, then save and next. And then this is where you're gonna put in your care manager, care coordinator, like your CMAs that are helping. The provider is going to be the physician or nurse practitioner that's overseeing everything. Caregiver, that's going to be the actual family member who is the main caregiver to the patient. And then click I'm done. There you go. You're done. And now this is where right here is where whenever you do anything with the patient, you are going to log your minutes here. It's best if you do it in real time versus going to the add time and adding it later. It just is more real and, you know, doesn't bring up a bunch of red flags. If somebody's going in and manually adding time all the time, it just, I don't know, to me doesn't look that great. All right, and then when you're done doing whatever it is you were doing for the patient, you hit stop, and then this comes up, and this is where you are going to say what it was you did. Got a lot of choices, choose what's the most appropriate, and then write your note here. I'm just gonna type whatever, and I'm gonna choose that I was assessing, or risk assessment, okay. And, ooh, look, even a spell check, okay. And then when you wanna go, oh, and it keeps track of the total time that has been spent on the patient, right here. And then this is where you would go to add the time manually. You know, it's kind of the same thing, except for you're putting the start time and the end time in. And I didn't even do anything, so X out. And then to view your logs right here, everything that you've done with the patient is going to show up in this log. And, you know, any note that you wrote is going to be right here, and you just hover over it and it'll show you what that note said. All right, so that's how to keep the time. And there's more. I'll let you know how I set reminders and stuff, but that'll have to be on the next one because running out of time. All right, thanks guys.